This is the Fertility Friday podcast, episode number 77. Welcome to the 77th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from FertilityFriday.com, and this is your source for information about the fertility awareness method and all things fertility. If you've been listening to the podcast for a while, then you'll already know just how passionate I am about connecting you with the tools and information that you need to improve your menstrual cycle health and your fertility naturally. And that's why I started the podcast in the first place, because I strongly believe that every woman has the right to know exactly how her body and her fertility works. And I feel so privileged to be able to share my passion for body literacy and fertility awareness with you every single week. Fertility awareness is so much more than just birth control or trying to get pregnant, because it truly gives you a window into your own health and fertility. And I love sharing my expertise with my clients and helping them to understand their charts and to connect with their cycles. So if you've recently discovered fertility awareness, but you're not feeling quite so confident about using it for birth control just yet, or if you've been charting for a while and you're finding that your cycles are all over the place and you can't really figure out what's happening with your mucus or your cervix, I can help with that. Get started today with a free 15-minute consultation with me by heading over to fertilityfriday.com/coaching, or just click the work with me button on my website. I can't wait to delve in with you and get started. And I'd also like to invite you to sign up for the Fertility Friday newsletter. So just head over to fertilityfriday.com/ebook. And as a gift to you, you'll actually receive a free copy of my new ebook, where I reveal what to expect when coming off of hormonal contraceptives. And I also share 5 steps to restoring healthy menstrual cycles post-pill. And today I'm very excited to welcome my guest, Dr. Victoria Jennings. Dr. Jennings is the director of Georgetown University's Institute for Reproductive Health, which she founded in 1985. She is also a professor in the Department of Obstetrics and Gynecology. She is an anthropologist with a focus on gender, behavior change, communication, and implementation science. And Dr. Jennings leads the Fertility Awareness Community Transformation Project. Dr. Jennings is also a principal developer of fertility awareness-based family planning methods and a major contributor in the implementation of these methods on a global level. And in today's show, we'll be talking about the standard days method as well as cycle beads. And so I'm really excited to get into that. So welcome to the show, Dr. Jennings.
Thank you so much for having me.
Well, thanks so much for being here. I was saying to you earlier that I actually had several of my listeners request that I do a show on the standard days method, and I thought it would be just a perfect fit for the podcast, and something that I know a little bit about, but not very much. And so before we dive into that, I'd just love for you to introduce yourself to the audience and talk a little bit about how you ended up working in the field of fertility awareness-based methods and family planning.
Sure. Well, I've always been very interested in empowering women and in the role of women in society and couple relationships and that sort of thing. My doctorate is actually in anthropology. So that led me to being interested in women around the world, not just women I knew. And so as a part of my graduate work and then postgraduate work, I was able to work in the field of women and fertility. So initially, like most people who come into the family planning field, I learned all there was to know about pills and condoms and IUDs, which is what was available at that time. But I was working globally. I was working in Latin America particularly, and I could see that there were women for whom these methods were not working well, in the sense that they didn't particularly like them. They felt that there needed to be something different. So I learned a lot. I had an opportunity during my postgraduate work to really learn a lot about fertility and infertility. So the sort of underlying biology was very clear to me, is very clear to me. And as a result of that, I began to be interested in fertility awareness-based methods of family planning, recognizing that women can plan or prevent pregnancy simply by knowing the days of their menstrual cycles when they are most likely to get pregnant if they have unprotected intercourse. Of course, it means that women need to have the agency or the capacity to influence whether or not they have sexual intercourse at those times. But it was something that just became such a fascination point for me that, in fact, I seem to have spent my career on it, almost unwittingly.
Oh, well, it's really interesting how I always find it fascinating. That's why I always ask my listeners how they found themselves in the fields that they work in, because I think it's really interesting how we end up, focusing on the areas that we focus. And so to kind of delve into the standard days method. So on the podcast, we've talked mostly about fertility awareness and the charting your cycles and the detailed process that entails. But the standard days method is obviously different to that. So maybe you could tell us what the standard days method is and how it differs from the cycle charting methods that involve observations and those types of things.
Sure. First, I want to say that those methods that you're referring to are really very excellent methods of family planning, and I have great respect and admiration for the people who have worked so hard to develop them. Because if it weren't for them, it would not have been possible really for us to have developed the standard days method. You asked why I was interested in fertility awareness methods, but now I'm going to tell you how I got from being interested in fertility awareness methods to the standard days method. Mm-hmm. I was at one point in a training in which providers, very competent providers who were not familiar with fertility awareness-based methods, were being trained in the symptothermal method, which I'm sure many of your listeners are familiar with, and the Billings ovulation method. And they were struggling. They were struggling to learn these methods. They were struggling to think of how they were going to counsel their clients in these methods and so forth. And I could understand that. While I myself knew the methods very well, I could see why they were so confused and frustrated by this experience. I began looking at the charts on the wall all around the room that people were standing back and looking at and trying to figure out. And I began to see what the pattern was that could lead us to more simplified, you might say, methods of natural family planning or fertility awareness-based methods. So with my colleagues who were with me there that day, we began talking about this and said, we really need to do something about this. It's a terrific opportunity to come up with something that will be appropriate for so many more women around the world. We were thinking particularly in low resource settings at the time, but in fact, these methods have spread far beyond that to some of the, when you look at Western Europe, the United States, Australia, many other places where people are using these methods. The methods that, some of the simpler methods that we developed, of which the standard days method is one. So we began by doing some theoretical testing. Where could we find data sets that would help us understand how we could, based simply on cycle length, identify the fertile days? So we took a large data set that characterized women's menstrual cycles very thoroughly from the World Health Organization, a data set that had been collected from women in 5 countries around the world. We examined that and created algorithms that we applied through a computer program that we developed. And we determined that, in fact, that women who have most of their menstrual cycles between 26 and 32 days long could consider themselves fertile on days 8 through 19 of their cycles. We took into account the fact that ovulation doesn't occur at the same time every cycle. We took into account the fact that cycles vary in length, both with the same woman may have a 27-day cycle one time and a 30-day cycle the next. And we also took into account the information that we had that's very well established about the potential for the woman's egg to be fertilized if she has sex a certain number of days before and after the egg is released from her ovary. So based on that, we developed the standard days method, which is, as I said, a method that works very well for women with cycles between 26 and 32 days long and identifies days 8 through 19 as the fertile days. But we knew that just doing that via a computer program was not good enough. We couldn't just go out and say, okay, now women can start using this. So we designed an efficacy trial to determine how effective the method would be in helping women prevent an unplanned pregnancy, both if they used it absolutely correctly every cycle and if they occasionally had unprotected intercourse on days that the method identified as fertile. So we conducted this trial in 3 countries, in Bolivia, Peru, and the Philippines. We have no reason to think that women's biology is different anywhere, so that aspect of the study could have been done any place. But we know that behavior is different and from one place to another, so we were expecting some variability, and in fact, we got it. But what we did find is that the method is 95% effective when used correctly, and that most people do use it correctly. Like most fertility awareness methods, however, if women don't use it correctly, that is, if they do have unprotected intercourse on days that are identified as fertile, their probability of pregnancy is relatively high. We found that it was 88% effective in what is frequently called typical use. That is to say, when you look combined at all of the perfect use as well as the times when women sometimes have unprotected intercourse on fertile days. So those were the results of our efficacy trial, and that is how you use it. Of course, we also developed a tool called cycle beads. We did this because we needed to be able to provide women with a tool, a very simple and visual tool, to understand their menstrual cycles and to be able to track 2 things. One, whether they were on a fertile day or not. And the second thing, if their cycles were between 26 and 32 days, which they need to be in order for the method to be effective for them in pregnancy prevention. So if you look at cyclebeads.com, you will see pictures of cycle beads. You will see all the information you would need to have in order to be able to use them and to be able to use this approach to family planning.
Well, yeah, no, it's really, I have a lot of questions coming to mind. I think it might be a challenge for educators who have been trained in the symptothermal method and know how much variability there is to kind of think about a method like this. I found when I was looking into the work in your YouTube channel for the Institute for Reproductive Health, is that right?
Yes, the Institute for Reproductive Health.
So that YouTube channel, I was just struck by the potential of this method to actually help so many couples kind of worldwide. I think that's what struck me about the YouTube channel, because you have interviews in lots of different countries and you're talking to the real people who are using it and finding that it's an amazing option for them. So I want to delve into that a little bit, but of course, so I have to ask, for the listeners who are hearing this and they're hearing that this is based on days and how many days your cycle is and anticipating the fertile window, is this the rhythm method?
That's a very interesting question and one I frequently get. And I have to say that all fertility awareness-based methods, including the rhythm method, whatever it may be, and we can talk about that in a moment, are based on identifying a fertile window during the menstrual cycle. So to the extent that the standard days method and the rhythm method both do that, and that they do it based upon cycle length, there is a similarity. If you ask the first 5 people you met what the rhythm method is, you would probably get 5 different answers. The point being that the rhythm method is not well defined. It has not been submitted to a real clinical study to see about its effectiveness, because it doesn't really have clear rules about how to practice it. Different people have different ideas about what the rhythm method is and how to use it. So while there are similarities, it's not the same. Mm-hmm. And I believe that it has to do with the rigor of the studies that have been done to examine the method and its effectiveness, and the fact that there really is a very clear protocol or guide for how to use the method,
Well,
which applies to everyone. It applies to everyone, and so there doesn't really leave a lot of opportunity for interpretation about how many days was that, and how long was my cycle, and what do I have to subtract, etc.
well, and also, it's obvious when you describe the method that it absolutely is not for everybody. So
No, certainly it
there's a
isn't.
very specific window, in terms of how long your menstrual cycle is for it even to work. So maybe you could delve into that a little bit more. So tell us, who is this method for and who is it absolutely not for?
Well, it does have, as you've just correctly pointed out, the biological criterion that you need to have most of your menstrual cycles between 26 and 32 days long. The efficacy study that we did allowed women, if you will, to stay in the study and continue using the method if they had one menstrual cycle outside of that range in a 12-month period. But if they had more than that, they were told that this method was not appropriate for them and that they needed to find another method of family planning if they wanted to avoid pregnancy. So it is definitely the case that women need to have their cycles between 26 and 32 days long. And most women do. Most women do have most cycles between 26 and 32 days long, but there are women who don't, and this method is not for them. It is also not for women who are in relationships in which they cannot really control whether they have unprotected intercourse on a fertile day. One would have to say that about all fertility awareness methods, and I think it's an unfortunate point to have to make, but it is certainly true that not all women have that capacity.
And that for various reasons, but if you don't have a cooperative partner or if your relationship is such that you can't really communicate about those types of things, then it wouldn't really work in that case.
That's really true. It's something, if the world were perfect, it would be different, but the world is as it is. So there are certainly women who are in relationships in which this method may well place them in some danger, or certainly would make them susceptible to becoming pregnant even if they don't want to.
Well, and, I have a lot of fertility awareness educators who listen to the podcast. And so I feel like there's like this voice inside that's like, this is, predictive and whatever. Maybe you could talk. Actually, what I wanted to ask you about was the period of time, so the fertile window. So one of the questions, so it struck me when I was researching for our podcast that the fertile window is then about 12 days. Is that based on the cycle beads, about something like that? Is it about 12 days?
Yes, it is 12 days long, and I'd love to tell you why that's the case.
I'd love to hear why that's the case.
Okay.
And
Yes.
I also want to hear how couples manage this and how, because I'd like to hear more about how couples manage that if they're open to having such a long window of where they can't have unprotected sex.
Excellent. Okay, so the reason why the fertile window identified by the standard days method is 12 days long is based on the following considerations. There's a lot of variation of when exactly during the menstrual cycle ovulation occurs. Many people think it happens on day 14. Well, that's just not true. It happens somewhere near the midpoint of the menstrual cycle, however long the menstrual cycle may be. So it's very important to take into account the variability of when during the menstrual cycle the egg is released from the ovary. Another point of variation is cycle length itself, so that if ovulation usually takes place close to mid-cycle, and your cycle is 26 days, or your cycle is 32 days, midpoint is at a different time. So we need to take into account the fact that cycles vary in length, including a given woman's cycles from one cycle to the next. And the third thing we need to take into account is the fact that the egg is able to be fertilized for up to 5 days prior to ovulation. In other words, the sperm enters the woman's reproductive tract and can stay around in sufficient quantity to actually fertilize the egg up to 5 days after a woman has unprotected intercourse. So even though the chances are much less if she had intercourse 5 days prior to ovulation than they are if, say, she had intercourse the day before ovulation, nonetheless, it's not an insignificant risk. Mm-hmm. Also, the egg is only able to be fertilized for up to 24 hours after ovulation. So we have to add a little time. We have to add the day of ovulation to that mix. So that means that really, in real life, there probably are only about 6 days during which a woman could become pregnant. However, identifying which 6 days those are and giving her enough flexibility to account for that variation is really important if a woman wants to avoid unplanned pregnancy. So that's the reason for the 12 days. Have I explained that well enough?
Yes, absolutely. And the second part of my question was because, one of the perceived disadvantages or actual disadvantages, depending on what your opinions and your comfort level of all fertility awareness-based methods, is that there is a window of time when a woman is fertile. And as a result of that, you have to manage your fertility during that time. So if your intention is to not get pregnant, then you have to either abstain from intercourse or, be open to a different type of intercourse or using some form of a barrier method during that period of time. And so with fertility awareness-based methods, when you're charting your cycles, you can kind of shorten up that window by, using the cervical mucus observations and the temperature observations. But with cycle beads, you have a defined 12-day window each cycle. So how do couples manage that? And do you find that couples are open to abstaining for that long period of time?
Well, that's a very, very good question again. Thank you for that. First of all, when you look at other fertility awareness-based methods, such as symptothermal methods and the Billings ovulation method, you would find that in reality, the total number of days that are identified as potentially fertile during the cycle, or at least days on which a woman should not have unprotected intercourse, turn out to be very close to the same. For example, in the Billings ovulation method, where women are instructed to not have intercourse at all during days of bleeding, even, let's say, the last couple of days when their bleeding may not be very significant, they're still advised not to have intercourse on those days. And also what is referred to as every other dry day, meaning they could only have intercourse on alternate days prior to the appearance of cervical mucus. So when you add all of that together with the days that there is cervical mucus present, you end up with even more, for many women, even more days of abstinence or alternative sexual practices or condom use or whatever during their cycle. And with symptothermal method, there are a variety of rules related to different approaches to symptothermal methods of family planning, but the number of days turns out to be about the same. So it is true that the standard days method has 12 days, consecutive days, that a woman is supposed to avoid unprotected intercourse if she does not want to get pregnant. That is the case. Not terribly different from other fertility awareness-based methods of family planning. And I think women who, first of all, there's a bit of self-selection of women who choose to use these methods compared to women who say, no, I could never do that. I'm going to have an IUD or I'm going to have an implant or whatever her other options may be. Women who are open to the idea of modifying their sexual behavior in some way are more likely to select a fertility awareness-based method than women who are not. So that leaves us basically with a situation of who's willing to do what, and I would have to say the answer to that is it depends. There are women who say, I do not want to use anything that is at all artificial. That may be for religious reasons, it may be for just personal reasons, whatever it may be. And I don't mean to use the word artificial in a negative way, but in other words, anything that interferes at all with the potential for my fertility, I don't want to use that. And so those are women who would choose, for their own reasons, to abstain on fertile days. And then there are women who say, well, I would prefer not to have to use condoms, but on the other hand, I do want to be able to have sex on a few of those days, so my partner and I are going to use condoms. Those women do that. And then there are women who say, we just do other things on those days. That's fine with us. So it's really all over the place. We've found, because a lot of our studies are in other countries outside the U.S. and outside of Western Europe, that it depends entirely on the culture, on what is acceptable there. For example, we found in India, where lots of people use condoms, that condom use on fertile days was very common. Whereas in the Philippines, where there's not very much condom use, mostly people abstained on fertile days. So it depends.
Well, and I want to go back to the effectiveness, because this is I think this is going to be a really interesting conversation and interview for the listeners, because at the beginning, when I asked you about the method, you said that the effectiveness rate is 95% with perfect use. And of course, the women that were selected for the study did have cycles within the specific parameters. So, a note for all the listeners who are on hormonal contraceptives and, thinking of coming off the pill, most women who come off of hormonal contraceptives, their cycles aren't going to look like that so consistently for a while. So it wouldn't necessarily be for them, I'm guessing.
There is guidance for using the standard days method and for using cycle beads. Again, if you go on the cyclebeads.com website, you will see all of these questions. But in a sense, it helps women screen themselves.
Exactly.
Can I use this method now? Do I need to wait? Or perhaps this method isn't right for me at all. Women who have been using hormonal contraception, as we know, and studies have shown, that there is some variability in their cycle as they return to what you might call their normal cycling, not influenced any longer by the use of a hormonal method, but nonetheless, there is some residual or sort of leftover influence of those methods for 2 or 3 cycles. So for those women, there is particular guidance about you should use an alternative method, potentially a barrier method, whatever they want to do, until you have had a cycle between 26 and 32 days long. So again, taking a look at that website, you'll see that there's a way for women to screen themselves for this.
Mm-hmm. Well, because I don't want to relay like the idea that this method is for everybody, because knowing the connection as well between a woman's menstrual cycle health and her overall health. If a woman is struggling with various things like thyroid issues or PCOS, her cycles could be all over the place. And, a lot of women will say they have cycling every 60 days because of various issues. So this is the symptothermal method can be used in those situations because of, the different aspects. But then this method wouldn't necessarily work for those women. But I wanted to talk about the effectiveness, because I was really just struck by I'll link to the YouTube page on the show notes. So if anyone's really interested to see, there's a ton of videos with families from around the world just talking about how this has kind of changed their lives and how it really allows them to plan their families and how it's been extremely effective for them. So, I want to get into the whole idea that fertility awareness-based methods, or, when they're lumped into quote unquote the rhythm method, or, a lot of women can appreciate that if they went to their doctor and said, I'm going to do standard days method, the doctor would basically look at them like a crazy person and think that they were using no method. So maybe you could talk a little bit about kind of the negative associations with fertility awareness-based methods. And also, I would love to get into a comparison of the effectiveness of something like the standard days method with no method and with other methods of birth control.
Well, in terms of the amount of, frankly, incredible bias against fertility awareness-based methods, I think we have to think of the sort of the history, if you will, of family planning and contraception. It has been extremely medicalized, so that doctors, and I don't mean to say all doctors feel this way or that doctors are bad for feeling this way. That is not the point at all. But many in the medical field are very concerned and want to do what they think is the right thing by their patients. And they see something that they themselves, the medical professional, controls as being the better thing for the woman. For example, I will insert an IUD in this woman and she says she doesn't want to get pregnant and therefore I know that she will not. Or this woman is saying that she doesn't want to get pregnant and I am going to give her pills, and I often give my patients pills, and pills help people get well, and pills are going to help her keep from getting pregnant. So it's kind of a mindset that comes along with being highly medicalized, if you will. And I think that is really what has happened to family planning. It has become sort of a medical issue. If you look at who provides it, it's usually health professionals. So when it comes to fertility awareness-based methods, which are based on education, which require the woman herself to have a certain understanding of her body, to modify her behavior, it's understandable to me to an extent that many in the health professions would look at it somewhat negatively. And that is in fact what happens. I think there are also some negative associations with the fact, and it's too bad that this has happened, that there are some people who are real advocates for natural methods or fertility awareness-based methods who have really criticized other methods unfairly, have created a sense of competition, if you will, or of these fertility awareness-based methods are better than the other methods. And other people respond on the other side by saying, no, they're not better, they're not as effective. So unfortunately, what we've lost in that debate is that women are at the heart of family planning, and what they want to use and what they want to achieve is what we should all be thinking about. So women who want to learn about their bodies, women who want to use a method of family planning that doesn't have any side effects, that she can control by various means, etc., she needs to have that. A woman who says, I don't want that. I just don't have time for that. I don't think that's going to work for me. I just want somebody to give me a shot. Fine. That's fine too. So I think we've lost sight of the woman in our zeal sometimes to prove that, quote, our method is better than other methods. Better for whom and under what circumstances should really be the question. So that is my sermon for the day on how I think we should look at family planning and often do not.
Mm-hmm. Well, I'm so glad that you brought that up because it's such an important point, and you're absolutely right when you say that, what the woman wants has been forgotten. So, as someone who's within the fertility awareness world, one of the things that I often say on the podcast is that there is no one method that's going to work for everybody.
No.
So, well, and something like the symptothermal method involves work, right? You got to chart, you have to observe. And I can completely, going back to what you said at the beginning of the podcast and how you switched your focus to the standard days method, sitting in the class, looking at all the charts and realizing that there is a bit of technique involved here, and there is a bit of observation, and, it does take a woman who's willing to do that, and not all women are willing to do that. And so if a woman is not willing to do that, what are her options? Exactly. If she doesn't want a hormonal method? I think that's a really good point.
Exactly. And also, not just women who are willing or unwilling, it's also women who have the resources to do that. Women who have access to the right kind of thermometer. Women who have, there are things you have to have in order to use other fertility awareness methods that you may not have access to for a variety of reasons. You probably know from reading about the Institute for Reproductive Health that much of our focus has been on the developing world and looking at very low resource settings where people may not have access to these things, or may not have a place to keep them or a place to use them, etc. So it was really important for us, from our philosophical position and just our area of interest, to come up with something very simple, which it turns out has now been pretty widely accepted other places. When you look on that cyclebeats.com website, for example, you will see an app that you can just download onto your smartphone that you can use for free to use the standard days method. It's just right there. Sort of the iCyclebeats or the CycleBeats app for Android phones or for iPhones, either one. So there's really an expanded availability of this as more and more people are having smartphones around the world, and we could talk about that forever. Mm-hmm. But it is interesting, and yes, one statement you made that I just want to repeat: there is no method that is right for everybody.
Well, and just to kind of address one of the political issues, like when I feel like jumping on my own soapbox on the show, is just this need for the westernized world to go into developing nations and, inject people with things. And, and it's putting women on Depo-Provera, putting women on Norplant. And those methods work for some women, but they don't work for others. And when you're living in an impoverished nation, if you have a really bad reaction to something like that, you may not even have access to a doctor who can remove it. I don't know how these things work. So I think the like you talked about, the desires of the women in these countries not wanting to have hormones and having that desire be respected. And the interesting thing about the standard days method, the CycleBeats, is that, medical professionals would probably dissuade women from doing this because there's a possibility, you could get pregnant. It's not 100% efficacy. Maybe you could talk a little bit about that, and why every single woman might not need, I guess, trying to get at that different women might be open to a method like this, even though it's not, quote unquote, 100% effective. And also maybe the myth of 100% effectiveness. Maybe you could talk a little bit about the comparison of the effectiveness of other methods.
Well, I think there certainly some methods that are very close to 100% effective. Sterilization being one of them. There are some obvious reasons why a woman would say, yes, that's exactly what I want. And there are also very clear reasons why a woman would say, that is absolutely not what I want when it comes to sterilization. And that would be male or female sterilization. Another method that is extremely effective is an IUD. There are women who simply don't want something inserted into their body like that. And they would say, I'd rather take a little bit more risk of pregnancy than have that. There are other women who say, that's for me. That's exactly what I want. So, in other words, there are some methods that a woman has to do very little in order to use them. All she has to do is go get it or have it done. And there it is, and there she is, and she doesn't need to do a thing further in order to avoid unplanned or unwanted pregnancy. So that is very true. But then there are women who say, that's just not where I am right now. That's not what I want. Maybe I'm thinking that I might want to get pregnant either for the first time or again in a couple of years. Maybe I would just like to be sure that I don't put anything hormonal in my body. I don't want to do that for a variety of reasons. And these women usually are a little bit more willing to accept the fact that these are methods that there are methods, among them fertility awareness based methods, that are not as effective as, let's say, an IUD. Let's say that an IUD is 99.9% effective, and the standard DACE method is 95% effective. That means that out of 100 women using the method for a year, not even one will get pregnant using an IUD, whereas 5 would get pregnant using the standard DACE method if they used it absolutely correctly every time. Those are probably very different women. A woman who opts for the one is not likely to be the same woman who opts for the other.
Mm-hmm. Well, and I think the important part of this conversation as well is that these methods, they need to be available for women so that women can make these decisions for themselves. One of the things that is amazing about cycle beads is that it looks like a necklace, and it's obviously low tech. It's a necklace, and
except if you use it on your cell phone.
Oh yes, you can use it on your cell phone. So there is tech, but not necessary. And you can take it into, a developing nation, maybe where women are, they have all these different options, and that is an option that is, extremely effective, especially compared to no method, obviously, and compared to other methods as well, because 95% compared to the IUD. And it puts the control in the women's hands themselves. And I think when I saw just how profound of an impact cycle beads can have as a method, it just really made me realize how it needs to be available for women. I think what I'm just getting at is there's no side effects, and it's very straightforward. And I believe on the website you had a document that compares kind of between other symptothermal methods, and it involves like one lesson that takes 20 minutes.
Mm-hmm, mm-hmm. Right, that's very true. It is. You have to think about the amount of time that it takes to learn it, the time that it takes to use it, to practice the method on a routine basis. What's going to work for you? Is it readily available in your community? I certainly am an advocate for all of these methods being very widely available, but it's certainly also true that a teacher or a counselor who is teaching women to use, say, the standard DACE method needs considerable training, him or herself. And many times that's not available. So again, it just all comes back to our desire here at the Institute for Reproductive Health to make these methods as widely available and accessible to women and couples as we can. So that is what has driven us. At the same time, we want to make things very effective. We want to improve the effectiveness of the methods that are available. And that is really one of the reasons why we've done the amount of research that we have around the standard DACE method, looked at it in actual use. We tried a variety of formulas in order to come up with it in the first place. We thought about how convenient it would be if there were only 10 days, and then we realized how many people would get pregnant if we did that, and women who were using this method. So we tried to balance the whole idea of it being easy, acceptable, suitable for as many people as possible, and at the same time acceptably effective.
Mm-hmm. And what would you say to, the fertility awareness educators listening to the podcast who've been trained in the symptothermal method that have always kind of, because you mentioned something about this kind of idea that certain methods are better than others. And there's definitely some of that, right? In the fertility awareness world. And
sure. I think everybody thinks, quote unquote, their method is the best. But I think, again, it's just really important for us, fertility awareness educators, researchers, women who are thinking about using a method, health professionals, whoever we may be, to consider the woman. And I would say that I think that the symptothermal method is an excellent method of family planning for many women. And I have great admiration for the people who are teaching it well and who are offering it as a choice to women. And I think that women should be allowed to speak for themselves and say, yes, I want to do this. That's exactly what I want to do. And if they say, oh, well, that's going to be really hard for me, I'm not sure I can do that, then I think these are people who need to be offered something else. So that's fine. I'm sure that there is criticism. I know there is. I've heard it from people who are teachers of and advocates of the symptothermal method. And I just hope that people can keep their minds open and think about the women they're serving rather than what they themselves hold dear.
Mm-hmm. Well, and we've talked about a lot of the advantages, I think I feel like one of the huge advantages is just the potential to help people throughout the world who may not have access to a teacher and to a thermometer, and to have a method that really is so effective that takes a very little amount of time to learn, and doesn't require like tech or hormones or medicalization. I think that the implications of that are huge. So we've talked about a lot of the advantages. What would you say are some of the disadvantages to the standard days method?
Well, I think the fact that it is only for women with menstrual cycles between 26 and 32 days long is a disadvantage, because if a woman has cycles outside that range, then there she is. There is, of course, the same issue, you might say, around fertile days and needing to modify your behavior and learn to manage those days. Whether that's an advantage or a disadvantage depends upon one's point of view. So I would like to go back to the idea, however, of the standard days method and its acceptability or appropriateness for women with menstrual cycles within this very specific range. Taking that into account, we have been working with a number of other researchers to develop another approach we call it dynamic optimal timing, or DOT, which again is based upon cycle length, but it is a bit more, shall we say, flexible. And I can explain why that is. The background papers on DOT are about to be published, so you can stay tuned for that. You'll learn a lot more about it. But essentially, the dynamic optimal timing, or DOT method, is available only on smartphones because there is an underlying calculation that goes on as women enter more and more cycles that allows her to potentially shorten the identified fertile time. And it also takes into account women with cycles between 20 and 40 days long. So look on, if you have an iPhone, you can download DOT, the app. You'll find out a lot more about it. And very soon, if you have an Android phone, you'll be able to do the same. I believe it's coming out in June.
And would you say that this technology is any way similar, related, like a distant cousin to Daisy or Lady Comp?
No, it really isn't, because there is really nothing other than cycle length that you need to be concerned about. So there is no temperature taking, there's no recording of anything else. It's all about cycle length.
Okay. And so one criticism from like fertility awareness educators might be that a method like this doesn't necessarily encourage a woman to learn about her cycle, monitor her cervical fluid, and potentially be able to identify if there are any health concerns. So how might you either like agree or disagree with a point like that?
I agree with it. That certainly is true. It doesn't mean that a woman can't learn those things. It just means that in order to use this method, she doesn't have to.
Okay. And do you find that women who do use cycle beads, do you find them to be more likely to inquire and learn about their menstrual cycles?
Well, more likely than women who would use other methods of family planning.
Yes, yeah.
Okay, not other fertility awareness-based methods, but just other methods entirely. Yes, obviously these are women who are very interested in. They're interested in their bodies. They want to learn. They just may be women who want to understand when they're fertile. They may be women who want to know a lot more about their cycles, in which case they need to go elsewhere to learn that, not try to do it just with this method. Just keeping in mind that this is an approach that helps women to avoid pregnancy if they don't want to get pregnant, and on the flip side, to get pregnant if they do, by identifying their fertile time based on cycle length. So it does not take into account anything else, and I agree that there are certainly people who want to use their family planning method as part of a total kind of package, if you will, of reproductive health. They may have some specific concerns. They may have PCOS, as you mentioned. They may have other kinds of menstrual disturbances that they're concerned about. And these are women who may indeed want to seek a different method. So I'm in agreement with you. I think we just, again, have to come back to what it is the woman's looking for.
Mm-hmm. Well, and I think that, with a method like this, you're using it specifically for birth control. That's the point, right? You can also use it to help to identify the fertile window, but ultimately it's kind of like a simplified fertility awareness-based method strictly for birth control that doesn't involve any of the detailed chart taking or any of those things. But with that comes the you don't end up having that information about your cycle. I would imagine though that, for women who for women who actually want to use a method like this, but find that their cycles, don't work, that could be the impetus for them to look into what's happening with their overall menstrual health.
Yes, I think it very well could be. It very well could be. I think, you don't just say to her, well, looks like this isn't working for you. Good luck. You're going to say, it's perhaps you need to look further into some of the reasons why this isn't working for you, why this may not be appropriate for you. So it is part of a package. I don't think you can just say, well, that's now this is the method and that's the end of it. I would want to point out, though, that a lot of women do use it in order to get pregnant. Now, you might say, but wait a minute, it's not really identifying your days of peak fertility. It's sort of describing all of these days as potentially fertile. And certainly, again, for a lot of women, it's not going to help them pinpoint that very critical time. But for many women who are just saying, it's time now, I'd like to get pregnant. They may have had a few cycles where they were trying and they were not successful, and now they've identified the time during their cycle when they are likely to get pregnant. So having intercourse on those days is clearly to their advantage. So it's very interesting when you look again around the world at various studies that we have done. We just finished one, by the way, in Kenya, in which they were using the app for Android phones. And I think that it was about 30% of women were using it to get pregnant, and about 70% of women were using it to avoid. But that's not uncommon. It's not uncommon at all. And then women will start out using it because they want to avoid pregnancy, and then they'll decide they want to get pregnant, and so they'll switch and start using it to help get pregnant.
Well, and one of the things that I read on the site was kind of the implications of something like cycle beads to help young women, adolescent girls, learn a little something about their menstrual cycles. Arguably, if you use cycle beads, you have a better understanding of your menstrual cycle than most women, period. Because after having been in the fertility awareness world for so long and having the good fortune of being able to teach women how their menstrual cycles work, how their fertility works, to teach them about the fact that there's a short window of fertility each cycle and how to specifically identify it with cervical mucus. As obviously, I teach the fertility awareness based symptothermal method, but how to identify that in of itself is a huge piece of information that most women don't even have. So
yes, you're so right. You're so right. And you know what people lack information about even more is male fertility. Mm-hmm. People really don't understand, and certainly fertility awareness-based methods have to take into account both male and female fertility. People really don't understand about male fertility either. You know, we've recently, I hate to keep referring to you to things on a website, but if you go to knowyourbod.org, you will find a fertility awareness quiz. It's just 10 questions long and obviously far from complete that we put out there about 2 months ago. And people around the world have been taking this quiz, and it kind of does this underlying scoring for us, and we can see what people know and what they don't know. And it's amazing. It corroborates all the research that I've seen anywhere about how little people know about their fertility. Mm-hmm. So anything we can do to improve that is a step in the right direction.
Mm-hmm. Yeah, I think that's interesting. Like the most basic thing you could learn from cycle beads, even if you don't want to use the method as birth control, is that there is only a specific window of time when you can get pregnant in your cycle. And if you can identify that method or identify that window, one way or another, and abstain from sex or abstain from unprotected sex in that time, then you won't get pregnant. And I think that is such a great takeaway. And just that, don't you wish that piece of the conversation was told to every single woman when she was 13?
Oh, yes, I do. Yes, I do. We've done a couple of projects one of the most recent one in Rwanda called Grow Up Smart. And it talked a lot about menstrual health and puberty, talks about boys and girls, not just about girls. And included in the little little bag that girls get is a set of cycle beads to learn about their periods and to learn about their cycles. And again, while all young girls, let's say 10, 11, 12 years old, if they're having their period may not be extremely regular yet, but nonetheless it's giving them this idea that there's a cycle here. It's called your cycle for a reason. And that's, I think that's really, really exciting. We've been really excited to do that. Mm-hmm. But I agree with you. Every girl should know about this. Mm-hmm. Every girl should know about it. It's just part of a basic learning about your body, thinking about growing up, thinking about being a woman. Menstruation and menstrual cycles affect every aspect of our lives. So, yes, we definitely need to know about them.
Mm-hmm. Well, and just a few final questions to end the show. And one thing I wanted to say is, of all the advantages and disadvantages that we've talked about, we didn't even mention the benefit of being able to predict your period.
Yes, you see, that's exactly right. In fact, one of the findings of that study that I was just telling you about, the project that we did in Rwanda, is that girls say, now I feel more comfortable going to school because I know when I'm going to start my period and I know when I should have pads with me. So, that alone is huge. Mm-hmm.
And then once you use them and you get a set, it's like any of the fertility awareness-based methods. Once you use the method and you get a sense of your cycle, it's a little different with the symptothermal because then you're pinpointing ovulation and you can kind of be very specific as if your cycles aren't always kind of within a specific range, you can really predict your period. But same idea with cycle beads, because you can only use it if your cycle is between 26 and 32 days. So then you really have a sense of, well, this is when my period's coming. So exactly. Huge benefit.
Yes, it is. It is an enormous benefit. So yeah, I'm really excited to have an opportunity to talk about it. One thing I think is really important for us to keep in mind is reasons why women don't use family planning, why women don't use a contraceptive method. And the reasons around the world are the same. One is because of concerns about side effects and the health effects of various methods, even though they may have an exaggerated notion of problems with other methods. Nonetheless, that's a reason why they don't use it. Another reason is that women think they're not fertile. They think, oh, I've had sex 3 times and I didn't get pregnant, so I guess I can't get pregnant. Or, I only have, my husband is only in town 1 week out of the month, so why bother to use family planning? It's amazing what people think in terms of that. And the other reason is that women think, my culture or my religion or my family or whatever, I believe that people would think badly of me if I used family planning. That's not so typical in the Western world, you might say, but think about young girls and being, quote unquote, prepared for sex, and whether they're worried about whether someone would think badly, if you will, of them for having access to or using a family planning method. Mm-hmm. So, I think we need to keep those ideas in mind and think, how do fertility awareness methods address some of those concerns?
Mm-hmm. Yeah. And I mean, at the end of the day, on the most basic level, I believe all women should be able to have that privilege and right, really. It should be every woman's right to understand how her cycle works, so that at least you know when your fertile window is, because that piece of information in and of itself is so valuable. Even for women who are in situations maybe that aren't ideal in terms of their relationships with their partner, you don't necessarily have to let on that it's your you know what I mean? Like, you have this agency that you would not have if you can identify your fertile window, in terms of being able to plan your family and decide how many children that you want to have, especially if you're not in the Western world and you don't have access to every single drug under the sun.
Exactly. Exactly.
Well, just a few final questions I usually ask to wrap up the show. What would you say is the biggest myth about fertility awareness-based methods that you'd like to see corrected?
There are two, and they're connected. One is the myth that they're not effective, and the second is that women either can't use them or don't want to. Those are both complete myths as far as I'm concerned, which means that a myth is usually based on something. It's usually based on a tiny grain of truth, but has been distorted, if you will, according to the bias of various people. So those are really the two things that I think they've been a huge challenge to overcome, and they remain so. It's a very big concern of mine personally, and I think of the field of people who are involved with fertility awareness-based methods, people who are teaching them, people who advocate for them, people who do research on them, and people who use them. So altogether, those are, I think, the big issues that we face.
Mm-hmm. Well, and before I ask the last question, you touched on something that I had wanted to ask and I didn't remember to ask. You've taken this method around the world, maybe not you specifically, but this method has gone around the world to different countries, developing nations, varying levels of education. Can women do so? Exactly relating to the myth that you talked about, the belief that women can't use this method. What has been your experience with regards to that particular myth?
Well, in terms of fertility awareness-based methods are too complicated. One of the things we've been doing is really trying to decomplicate them. I do think that there are some methods that are pretty complicated. There are women who are very willing to use them despite that, or perhaps even because of it in some cases, because they really want to learn about their bodies and they find this fits well into their lifestyle. But decomplicating is exactly what we have been focusing on for many years here at the Institute for Reproductive Health. In terms of the second part of your question had to do with effectiveness, and the ability to manage the fertile days.
Yeah, like if they would comply.
Right. And again, I think it is so dependent on the individual and on their relationship and on the social support that they have for using a fertility awareness-based method. Women who have a partner who agrees, women who have a partner who's supporting them, women who live certain types of lifestyles, etc., are more likely to be successful than women who are in a different situation. So it's quite variable. But to be able to make the assumption that a woman can't comply or won't comply, I don't even like the word comply in this case, but that she won't be able or willing to do this, is, I think, perhaps to undervalue her own skills and ability. We need to let her decide.
Mm-hmm. Absolutely. And last question of the day, what would you say is the biggest myth about fertility in general that you'd like to see corrected?
I believe that it is the efficacy issue, and I would approach that from two points of view. One is that, in fact, fertility awareness methods can be very effective, particularly when they're used correctly. That's the case with a number of other methods. For example, pills, oral contraceptives, which may be quite effective when taken absolutely perfectly, and down around 90% effective when in what is referred to as typical use. When women sometimes forget to take their pill or don't take it at the right time or don't start a new cycle on time, etc. So the myth around efficacy, you can look at it from the standpoint of yes, but they are effective. And the other idea is that around efficacy is that many people believe that the only concern women have about a contraceptive method is its effectiveness. Women are only going to want to use the most effective method. That's been proven over and over not to be true. While there are women who say, absolutely, I want the most effective method I can possibly get because I absolutely do not want to get pregnant under any circumstances, there are many women who do not feel that way. So the idea that effectiveness is the only criterion is incorrect.
Mm-hmm. I think that's a really important note to end on. I think that obviously women are not robots or machines or something. And so you can't just assume that effectiveness is the most important and only factor in a conversation about contraception. So Dr. Jennings, thank you so much for being here today. I really appreciate you taking the time to talk to, me and the listeners. I feel like I've gotten so much out of this interview and really kind of expanded my knowledge and awareness of different fertility awareness-based methods. I'm so thankful that we were able to have this conversation today about the standard days method and cycle beads. And I think it'll also be really informative for a lot of the fertility awareness educators, as well as all of the listeners who may not have known very much about this method. So thank you.
Well, thank you, Lisa, for having me on. I really appreciate it, and I look forward to continuing this conversation.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode at fertilityfriday.com/77. If you've been enjoying the podcast, please do look for it on iTunes and leave a 5-star review so that more people can find it. And make sure to head over to fertilityfriday.com to join my email list. If you have an idea for a podcast episode or a guest suggestion, shoot me an email at info@fertilityfriday.com. I love hearing from you, and I've been getting some really great suggestions for guests on the show and podcast ideas. So thanks so much. Keep them coming. And remember, you don't have to figure it out all by yourself. I absolutely love helping women to connect with their cycles, and I can't wait to delve in with you and help you bring your cycles back to health. So if you'd like to work with me, head over to fertilityfriday.com/coaching, or just click the work with me button on my website to set up your free 15-minute consultation. So thanks so much for hanging out with me today. I do appreciate all of you for taking the time to tune into the podcast and to let me be part of your day. No matter what you're doing, whether you're on the go or driving to work or going for a jog, thanks so much for hanging out. And as always, until next time, be well and happy charting.